How to relieve back pain during pregnancy. Safe tips. Back pain is a common complaint during pregnancy, especially in the second and third trimesters. While discomfort is natural, there are several safe and effective ways to relieve back pain during pregnancy. 1. Practice good posture. As your belly grows, it's easy to slump or arch your back more than usual. Keep your feet hip-width apart and avoid locking your knees. Pelvic tilts and stretches targeting the lower back can also offer relief. If you need to lift something, bend from your knees, not your waist, and keep your back straight. Hold the object close to your body and avoid twisting your torso. Ask for help when lifting anything heavy. 4. Wear the right footwear. Instead, opt for supportive, low-heeled but not flat shoes that provide good arch support. Orthotic inserts can also help relieve pressure on your spine. 5. Sleep smart. Sleeping on your side with a pillow between your knees can take pressure off your lower back. You might also place a pillow under your abdomen or behind your back for additional support. A full-length pregnancy pillow can offer all-around comfort and help you sleep better. 6. Apply heat or cold. A warm compress or heating pad applied to your lower back can soothe sore muscles. Cold packs can reduce inflammation and numb sharp pain. Prenatal massages from a certified therapist can help relax tense muscles. Some women also find relief through prenatal chiropractic care, which focuses on realigning the spine and pelvis.